This lesson is brought to you by Dr. Keshav Narain. You need to hear this if you're someone who's ever struggled with daily headaches, blurry vision, or a strange pulsing sound in your ears. These symptoms can be frustrating and even a little scary, especially when they start to interfere with your daily life. Many people brush them off as just stress, fatigue, or the result of staring at screens for too long. But what if there's something more going on beneath the surface? Well, it might not just be stress or even a migraine. Sometimes these symptoms are a sign of a lesser-known but serious medical condition that often goes undiagnosed for months or even years. It's important to pay attention to what your body is telling you, especially if these symptoms keep coming back or are getting worse over time. There's actually a condition called Idiopathic Intracranial Hypertension, or IIH, that can mimic the symptoms of a brain tumor, but without an actual tumor. IIH happens when the pressure inside your skull increases for reasons doctors don't fully understand. This pressure can press on your brain and the nerves that connect to your eyes, causing headaches, vision problems, and even ringing in your ears. It's sometimes called pseudotumor cerebri because it acts like a brain tumor, but scans show there's no mass present. And here's the surprising part: your weight could be a major factor. IIH is most common in women of childbearing age who are overweight, but it can affect anyone. Research shows that even a small increase in body weight can raise your risk, and losing weight can actually help reduce the pressure inside your skull. That's why doctors often focus on weight management as a key part of treatment. Let's break down how managing your weight could protect both your vision and your brain health. By understanding IIH and its connection to lifestyle, you can take steps to reduce your risk, recognize symptoms early, and work with your doctor to keep your brain and eyes healthy for years to come. IIH, or Idiopathic Intracranial Hypertension, is a condition that can be both confusing and frightening for patients. It used to be called pseudotumor cerebri, a name that hints at just how tricky it is to diagnose. The reason? The symptoms, like severe persistent headaches, vision problems that come and go, and even a ringing or whooshing sound in the ears, can look and feel almost exactly like those caused by a brain tumor. Patients often describe a pressure inside their head that just won't go away, and sometimes they experience double vision or brief episodes of vision loss. These symptoms can be overwhelming, making daily life difficult and causing a lot of anxiety and uncertainty. But here's the important distinction: there's no actual tumor present. The real culprit behind all these symptoms is an abnormal buildup of cerebrospinal fluid, or CSF, inside the skull. This excess fluid increases the pressure within the brain, especially around the optic nerve, which is responsible for carrying visual information from the eyes to the brain. When this pressure builds up, it can cause swelling and damage to the optic nerve, leading to those troubling vision changes. Imagine the optic nerve as a delicate cable, or even like a garden hose. When too much pressure is applied, like stepping on that hose, the flow is disrupted. In the case of IIH, this means the signals from your eyes to your brain can get blocked or distorted. If this pressure isn't relieved in time, it can cause permanent vision loss, making early detection and treatment absolutely critical. Unfortunately, IIH is often missed or misdiagnosed in traditional healthcare settings. That's because its symptoms overlap with much more common conditions, like migraines, tension headaches, or even anxiety disorders. Many patients spend months or even years searching for answers, seeing multiple doctors, and undergoing countless tests before the true cause is discovered. Even advanced imaging, like MRI scans, can sometimes fail to reveal the problem until significant damage has already occurred. The changes caused by IIH can be subtle and easy to miss, especially in the early stages, which is why so many cases go undetected until vision is already at risk. That's why at South Bay Retina, we believe in looking deeper and acting earlier. By using advanced eye imaging and specialized testing, we can spot the warning signs of IIH before permanent damage occurs. Our approach is thorough, compassionate, and focused on protecting your vision and your quality of life.